What if you could narrow the disparity gap by implementing spaces within the healthcare system that provide culturally concordant, patient focused care throughout the medical center? A health information delivery method that strengthens trust, improves patient perception of healthcare, as well as increase staff and clinician joy and meaning in medicine. And oh, let's not forget, engages 200 plus patients at a time. Before I tell you about HouseCalls, I want to share a story. A 53-year-old African American woman is in the ER with chest pains and loss of feeling in her legs. Her blood pressure is high. However, the EKG and the cardiac enzymes are normal. Therefore, heart attack is ruled out. Imaging reveals an aortic aneurysm pressing against her thoracic mid-spine, which explains the numbness in her legs. As she's being wheeled into the operating room, the surgeon delivers the news. You have 20% chance of survival, and if you do, you may never walk again. 2 weeks later, she's visited by 2 doctors. The first doctor, her spine doctor, leans in and learns by asking that she's a fitness instructor, yoga teacher, and once completed a triathlon. He sat down with her and shared a story of a 4-lane highway. The first lane, he named Lane A, had no movement. The fourth lane, Lane D, had some movement. He emphasized that only a determined driver could navigate past the barriers to find their way forward. The takeaway for her was that she could walk again if she believed she could and really wanted to. He explained how it was possible and then reminded her before leaving that this journey would be a marathon and not a sprint. The second doctor, the vascular surgeon, collected her vitals and provided directives and warnings. The details were fuzzy, but what she recalls from the conversation was the fear of impending death. Well, 5 years later, and I'm still alive, and I'm walking. Moreover, I'm confident in my ability to strengthen. Thanks to the generosity of my colleagues and the community of clinicians, therapists, physical therapists that helped me explore options and resources to support my healing. I now walk, I swim, I teach yoga, I travel, and I play. Dr. Chow was right. The strengthening of my body is as much as a marathon as life itself. My vascular health team saved my life, and I am beyond grateful. They continue to fulfill their role in the system by delivering data and directives. If they have a goal, it is to keep me from dying. While my goal is to live strong. This experience, coupled with shelter in place and the rise in the disparity gap, motivated my vision for HouseCalls. HouseCalls was launched in September 2020. It's a virtual space for patients and health specialists to connect. HouseCalls encourages discussion and learnings about the importance of preventive health practices, interventions, and the healing that is possible. Patients are invited to text in questions and comments, many of which are read during the broadcast. As the woman in this story, I am fortunate to benefit from the 21 patient-centered discussions produced over the last 2 years. It is here where I am learning the nuances of the human body and its miraculous capacity for healing. While you are searching for solutions to close the disparity gap, I encourage you to consider HouseCalls, a patient-centered program that breeds trust, dissolves fear, and empowers patients with choices to either be alive or to live a life to thrive.